Hi, and welcome to this installment of Frank and Mary here in Northborough. For those of you who haven't seen the show before, my name is Arthur Bergeron. I'm an elder law attorney at Myrick O'Connell. There are 70 of us. We're actually, I think, the biggest firm outside of Boston in Massachusetts. But as a result, everybody gets to do what they like, and I really like doing this. And these shows, in many ways, were started to supplement seminars and other things that I do, but they are not about law. They're about Frank and Mary, my friends Frank and Mary, that you've probably heard about, and their kids Peter, Paul, and Mary Jr. And Frank and Mary's goal is to live in their house until they die and be buried in the backyard. And here in Northborough, they want to live in their community. They don't want to move away. They just as soon not move in with their kids someplace, because the people they know are here. So the question is, who are the people they need to know? What are the programs they need to know about in order to stay here in Northborough? Now, a piece of that is knowing about your health insurance, right? And while the health insurance issues are bigger issues, they're state or national issues, Frank and Mary really need to be able to note to get that part right. So actually, I do seminars at the Northborough Library with my friend Christine Alessandro from Bay Path Elder Services. We're going to do one next Monday, Monday the 20-something. And so you may see this and therefore go, or you may have not seen the seminar and therefore want to learn about this. This is about Medicare. This is all about Medicare, and specifically about Medicare C. What you have, if you have regular Medicare, what everybody seems to be referred to as regular Medicare, is a combination of Medicare A and B. And you have an alternative to that, though, which is to have Medicare in which you are actually working with a company that is managing all of that care. And there it starts getting complicated. So that's what we're going to talk about today. So I invited to talk about it one of the major carriers in Massachusetts that deals with all kinds of insurance, but among other things, they have Medicare C plans as well as so-called Medicare supplemental plans. We're going to talk about that. They are from Fallon. Fallon's actually the biggest of the carriers in this area, Brian Guanini and Bill Bjerke. And Brian covers primarily Worcester County, so that's one of the reasons that he's here, and Bill covers east of that, but they're very close because he's over in Middlesex County. So now, we're going to talk about Medicare C, but as we were talking before the show, to understand the point of Medicare C, you have to understand Medicare A and Medicare B. Right. So talk about that a little bit, right? Just so we've got the right framework. So what is Medicare A and Medicare B, and what do they cover and how do they work? Is that a fair question?
Very fair. So Medicare A is the hospitalization care component of Medicare that people receive typically for nothing when they've had 40 quarters of Medicare taxes taken out of their paycheck in their lifetime. So 10 years worth.
So by virtue of having been in Medicare, you're in Medicare A, and Medicare A is pretty much, you're not paying a big check into Medicare every month on account of Medicare A, because the money's all the money that you paid in when you were in the system.
Correct.
Right. And
right. So that covers hospitalization, hospice care, home care, and skilled nursing care.
I get it. So quite a few things. Quite a few things.
Yep.
So if I'm on Medicare and I go to the hospital, I'm going there for free because I'm on Medicare?
Well, not necessarily.
So talk about that.
Right. So Medicare A, again, is your inpatient hospitalization component of Medicare. So if you
So it applies if I've been admitted to the hospital.
Correct. Right.
Not if I'm just in the emergency room and I leave that day. It doesn't cover that.
Correct. Okay. So Medicare B would cover that. We'll talk about Medicare B in a second.
Yeah.
So what would happen if you just have Medicare A and Medicare B? You alluded to it a minute ago. It's called original Medicare, or you called it regular Medicare. Same thing. Yeah. What happens if you have original Medicare is you don't have any other supplemental plan. You've decided to just keep Medicare A and Medicare B. Yeah. Medicare B is what you pay for. Right now, if someone were aging in 2019, it would be $135.50 a month.
I'm sorry, and we're going to get to them, but
we're going to go
back to A.
Okay,
so A, I'm in the hospital, and I'm on Medicare A, and I haven't been paying into Medicare since I got on it because I paid that when I was younger, right?
Correct.
But now I'm at the hospital, and so you just said maybe but I still have to pay something at the hospital?
What would happen is you would be allowed to be inpatient. You know, they can't deny you, so you would be able to go there. When you receive your bill, you're going to end up, the government's going to pay 80% of that bill because that bill's going to go from the provider, whether it's a hospital, doctor, wherever, to the government. They pay 80% of that. Then that bill goes back to you to pay the remaining 20%. There's also a deductible on top of that for Medicare Part A. If you go inpatient, it's a $1,384 deductible on top of what you pay.
So the first day I walk in, right off the top, I'm paying $1,384
plus 20% of whatever the bill is.
And then however long I'm there, or however much they figure out the bill is, Medicare is going to pay 80% of that, and I'm going to get sent a bill for the other 20% of that bill.
Correct.
Okay.
So an example would be if you were to have a heart attack. $100,000, let's just say, for a nice clean number.
Yeah.
You go in there, the bill's $100,000, you go home, you're better, the bill goes to the government, they pay $80,000 of that $100,000, the bill comes to you, you pay $20,000.
Or I pay the 13, whatever it is, plus
Correct.
20% of a...
Plus the $1,384 deductible.
I get
Correct.
it. So the first thing Medicare A covers is the hospital.
Correct.
Using that formula.
Yep.
And then they also cover some nursing home care, some skilled care.
Hospice care, home skilled care.
Right.
Correct. Yep.
Or just kind of regular Medicare A, just like if I just go from the hospital to the nursing home, right? Then there's some, like,
nursing home care isn't typically covered by Medicare or by Fallon, at least, with Fallon Health. That would be probably a long-term care situation with different carrier.
But there are other pieces that Medicare covers. And tell me what those other pieces
The other pieces on Part A,
Yeah,
so
on Part A.
skilled nursing care, home
Yeah.
care, and hospice.
Right.
So skilled nursing, rehabilitation, home care would be if you needed to have somebody come in and help you, and hospice care, we all know what hospice care is, so
Yeah.
that would be covered as well at an
Yeah.
80-20 situation.
And so they're always 80-20 splits in any of those situations,
Correct.
right?
Correct.
And skilled and this rehab care, it could be in a nursing. I guess when I was thinking about nursing, it could be in a nursing home, right? But once again, contrary to a lot of people's expectation, you go to that nursing home, it's not 100% covered by Medicare. You're going to pay 20% of that bill. Right?
Correct. Medicare will pay 80% of what's usual and customary,
Yeah.
what they get billed. Correct.
And then there's can you just spend a second talking about hospice and how that works, and then about that home care program?
So the way hospice will typically work is if someone is going into hospice care,
Yeah.
again, the bills would be generated, would go to the government to pay 80% of that, and then back to you for the other 20%.
I get
So
it.
most of it's being paid for. But again, as you alluded to earlier, A's, it doesn't cost anything as long as you've had that Medicare component taken out of your paycheck.
So that's, and once again, there's that home care benefit. And I've told people, many people are totally unaware of the fact that benefit even exists. They
Right.
assume that in order to get any home care that's paid by Medicare, you need to have gone to the hospital first. And I tell them, no, if your doctor says, you're really disabled and can't get out of the house and you need that home care, Medicare can provide it. But once again, there's going to be a payment.
There'll be a payment. They're always, and one of the misconceptions a lot of people hear about Part A is that it's just inpatient hospitalization care. As we've spoken about for the past few minutes, it's more than that.
Right, so that's a pretty substantial package. So that's Medicare A.
Correct.
Now talk about Medicare B.
So Medicare Part B is everything else. So we like to say when I do my presentations, when Bill does his presentations, we talk about Medicare B is everything else. Your emergency room copays, your lab work, your doctor's visits, your ambulance rides, everything else that's not inpatient
So
hospitalization.
even your doctor going to that hospital to see you at that hospital is going to get reimbursed through Medicare B. as
Medicare
opposed to
Part B.
Right.
Right.
If the doctor works for the hospital, then it's part of the hospital bill, and then it's a Medicare A.
Could be,
Right.
if it's
Right.
billed as part of the inpatient
Right.
up deal.
And the drugs that you're getting, all of that stuff, that all becomes a Medicare B. That's a Medicare B number. Or not, how about, the drugs at the hospital. If you're getting administered
under
drugs
A.
at the, that's an A
It's
number.
under Part A. Yeah, as
I
long
get
as it's billed under
All the
the
expenses.
I
inpatient
get it.
hospitalization.
But if I go to the emergency room and I don't get admitted, and I go back home, the hospital's sending Medicare B, a bill, but it's being paid under Medicare B.
Through Medicare Part B, correct.
Medicare
Yep.
B.
Yep, so the way Part B works is when you become Medicare eligible, I'll go back to when someone comes to see Bill or I and inquire about a senior plan. The first question we'll always ask them is, do you have Medicare Part A and Part B? Because you can't have a supplemental plan, whether it's Medicare Part C that we're talking about today or the Medicare supplement plan, unless you have A and B and you're actively paying your Part B premium. So Part
see.
B premium
So
right
talk
now
about
is
that.
$135.50 per month
Yeah.
for someone that's aging in 2019. It's going to be more money if you make a lot more money
Yeah.
in your retirement and you're Medicare eligible, you'll pay more.
And by the way, Do you happen to know, now this is just trivia, I'm not trying to put you on the spot, where that first jump occurs? Because I know everybody thinks about this amount as being the Medicare B amount, the 100 and, how much is it now, 100?
85,000 for individual and 170,000 for
Ah,
a
so
family.
you really have to be making more money. If you're a couple, if you're Frank and Mary, then you only start paying more in that Medicare deductible if your total income is more than about $170,000. So that's a lot for my clients. That's a lot of money.
Right, and what that equates to is what'll happen is your Part B premium won't be $135.50. It'll be more than that. And what happens is they actually, it's a step system where if you make a lot more than 170, then you're going to pay a lot more for Part B.
Yeah,
So
I
it
remember
goes-
talking about somebody that actually was paying 400 and something
Wow.
monthly, right, on that little extra payment. So but the point is there is a monthly payment because you're kind of paying additional money into the system. And then if you need medical care, so if you say that you're this is my emergency person again, right? And she went into the emergency room, or I went in and I didn't end up staying, or I stayed for a day or two on observation, increasingly what the hospitals do, right?
Right.
They won't admit you; they'll just put you on observation. So now there's a bill that's being generated, but that bill is being paid through Medicare
Part B.
B.
Correct.
And how does that get figured out?
So it's almost the same as Part A. So what will happen is when you go to the doctor for any type of service outside of inpatient hospitalization, again, the bill will be generated by that provider. Go to the government for Social Security, Medicare, they'll pay their 80% portion of that. Then it comes back to you to pay the 20%. If you're on original Medicare.
If you're on original Medicare.
Right. If you decide not to choose any other carriers plans, supplemental plans, whether it's Medicare Advantage Part C or Medicare supplements or Medigap plans, which we might talk about.
And we're going to talk about that.
Great.
We're going to do the Medigap next.
All right.
But I just wanted to be clear. So if you're just on basic Medicare, and except for the hospitalization and this kind of a given number of days in rehab, and a couple of other things. All the rest of it, first of all, is covered by Medicare B, and to be on B, you're paying a monthly charge anyway, which is probably being deducted from your Social Security.
Correct.
And whatever is happening to you, Medicare is paying 80% of the bill, and you're paying 20%.
You should also note that if someone is not yet retired and not getting a Social Security check, they can be billed on a quarterly basis for the Part B.
For Part B.
Yes.
Right.
If they want to be on Medicare. If they want to be on Medicare.
If you're not collecting a Social Security check, it will not be deducted, obviously. So
see, the reason why I'm really paying attention here. So I'm 69,
Really?
So but I'm not in the system yet. I'm not in the system because we're still on, because our company still has insurance, right? But now trying to figure it out and balance it out, that in itself is, I need to hire a consultant to figure out how
That's what we do.
That's what we do. And also, Arthur, it's interesting you mentioned that. There are many people that work well beyond age 65 who stay with their employer group. For many people, it might be an advantage to take a look at the Medicare. They may be having a payroll deduction that's significant that they could probably avoid by going with a Medicare product.
Which is exactly what I'm trying to figure out, because our firm pays a percentage, but not 100%.
And the most important thing is to check with your HR people to find out if you should drop out of the plan for some reason. Are you able to re-enroll with them?
And
in most cases, the answer is no.
In most cases, the answer is no.
Once you leave the group, you are out.
You're out. Yep. So I'll tell them that you said that when I'm going through this. So that's how Medicare A and Medicare B work.
Correct.
And by the way, now I'm just going to mention one other thing, which I did mention at the beginning. Then we're going to skip over C for a second. Then there's Medicare D.
Right.
And Medicare D was what was kind of the gift to us from George Bush, right?
George Bush, 2006.
That actually added a drug benefit. Right. And that's a whole other system. Although, just as a trivia question, is the enrollment period for Medicare A and B the same as the enrollment period for Medicare D? Is it the same? I know that they're all around the end of the year. I didn't know if they were all the same.
They are. It is. So that's called annual enrollment period, AEP, and that runs from October 15th to December 7th every year.
Yeah.
And what that allows somebody to do who's Medicare eligible, whether they're enrolled or not on a plan at that time, they can submit an application during that time from October 15th to December 7th.
And you can change every year, right?
You can change every
plans
year.
Every year.
Yeah.
See, until we met a few weeks ago, right? I had known that Medicare D, the drug plans, you always check, you do it again every year. and that that it was advisable to do that because these drug plans, what they're offering would often change from year to year, right? So you might actually have a drug that was on somebody's plan one year, and if you're not paying attention, it might be gone the following year. So you need to check it. I never knew that the same was true for Medicare, for the Medicare A and B, that you could.
Right, and which is why it's important for people to really keep up on this and maybe attend some of the meetings that Bill or I might do, or some of the other carriers might do, because that information's offered. Usually we get the information about the new plans in October, beginning of October. So we can actually go out to these presentations and let people know, here's what's changing with your plans. Some of these drugs may have switched tiers. Some of these drugs may have gone up a tier or down a tier, which changes their payment, their copay. So it's important for them to really attend each year to kind of know what's happening.
To understand, because I remember in a conversation that I had with the two of you, one of the things that you mentioned was, what you really need to look at every fall is how you're feeling, right? Because it may be, if you're willing to take the risk, right, and you're feeling okay, you may say to yourself, well, I only need this particular plan for this year because I'm not anticipating big trouble, right?
Right.
But if you're at the middle of the year and you're like, oh, this is going to be a bad year, they've got to let you enroll. There's no pre-existing condition, none of that stuff. So you have the ability to change any time to really fit your own needs, which
Great
is really
segue. So we talked about AEP.
Yeah.
Open enrollment period is something that was new for this year. So this is a period of time from January 1.
You just used a code term, AEP. We talked about
Annual enrollment period.
Annual enrollment period.
October 15th to December 7th. Now, open enrollment period is January 1 to March 31. It was new this year, first time the government ever tried this federally. What that allows people to do is change their plan once, anytime, from January 1 to March 31, as long as they're already enrolled on a Medicare Advantage plan. So if someone is enrolled on a Medicare Advantage plan and they come to us and they say, anytime in January, February, March, say, this plan's not for me for whatever reason, whether it's price or whatnot, we want to change to a different Medicare Advantage plan, they can do that one time.
And so we're going to talk about that again when we get to Medicare Advantage. So now I want you to talk about Medigap. So as we've said, if you're just on Medicare and you haven't bought any other insurance on your own, you're paying very little. You're not paying anything for A, you're paying this little monthly thing for B. But now you got some payments in case you're sick.
20% is your responsibility.
And most people don't kind of think about that because they have a Medigap plan. So what's a Medigap?
So a Medigap plan is the second type of plan somebody can enroll on when they become Medicare eligible. The first type of plan is Medicare Advantage. Second type of plan is Medicare Supplement or Medigap. So Medigap or Medicare Supplement works similar to the 80-20 situation we talked about with Original Medicare. When someone enrolls on a Medigap plan with us, we have two of them at Fallon. We've got a Medicare Supplement 1 plan, $229 a month. They can go see any provider in the country that accepts Medicare. There's no provider network. There's also no copays for anything. That's $229 a month. The other type of plan is called a Medigap or Medicare Supplement Core Plan. That plan's less money. It's $126 a month. And what that does have is it has the $1,384 deductible that's applicable every 61 days. And it also has a $185 deductible for doctor's visits, specialist visits, and whatnot.
I see.
Those two plans are our Medicare Supplement offerings. Now, if somebody were to join one of those plans, what would happen is when the bill goes from their provider to the government for the 80% payment, instead of that bill going back to the member, it goes to Fallon Senior Plan because they're on our supplement plan.
I see. And then Fallon, depending on which plan you're on, will either pay the entire amount of that gap, right, or this percentage of the gap, and then send it on because there's some kind of a deductible or some amount that they have to pay.
Correct.
Right?
What I tell people is if you're on the $229 plan, you won't pay for anything throughout the year, just the $229 per month.
Right, and that comes out, it's about $2,500, well, a little less than $3,000 a year.
Correct, right, but there's no network and there's no copays. On the $126 core plan, which is also a really great plan, you're paying $126 a month. You do have those deductibles. You're subject to those deductibles. You may never ever pay them. You may never have to pay them, but you do have that looming over as a responsibility.
Arthur, I think it's also important to note that there are those two plans, the core and the supplement one. They might be a different name with a different insurance company, but here in Massachusetts, those are the only two options you have, either with the deductibles or without.
So no matter which company you're talking to, there are basically going to be these two plans to kind of match up.
There may be some special benefits within the particular supplement plan to attract people into that
Yeah.
plan. For instance, ours has a vision rider and things like that. So it's always important to look at your options.
Look at and so if for many of us, including me, until fairly recently, that was Medicare, right? And then I started reading more about Medicare C, right, which is often referred to as a Medicare Advantage plan, because most folks realized this Medigap, they knew that they were on Medicare, they bought this other policy which was just kind of supplementing those gaps, right, and that took care of that. So, but then there's Medicare C,
Right.
Medicare Advantage.
Right.
How does that work?
So Medicare Advantage, as I said earlier, is the first type of plan you can enroll on if you become Medicare eligible. It's an HMO type plan, which means
what does that mean?
It means that you have to name a primary care physician as your gatekeeper of your care.
Yeah.
Anytime you see a doctor that's not your primary care physician, you would have referrals sent in to Fallon. Would go out and get referrals from your doctor, letting us know it's okay for you to see a specialist. There is a network of physicians and hospitals that's part of the Fallon Senior Plan that you would have to stay within, if you were to join. So, for example, in this area, Southborough Medical Group's right down the street. We've got
Which is that's huge here in
It's
Northborough.
huge.
It's huge.
Yeah, but they're part of what we call Reliant Medical Group, and
Yeah.
Reliant Medical Group is a limited partner with our Medicare Advantage plan. In other words, people on 5 of the 6 plans that we offer here in Worcester County can't go to any of the Reliant Medical Groups for primary care because there's a contractual agreement between them and another carrier.
I see.
That may change, we hope, but we do have one plan that allows them to go there for specialty care, but we've got so many other providers in this area that are part of the Medicare Advantage network for all 6 plans.
And so, for example, if you're here, the places where you're going to the hospital,
Right.
you're going to the hospitals in the UMass system. You're probably going to Marlborough Hospital, or you're going up to UMass itself, or
Correct.
you're going to St. V's.
Correct.
Or maybe you're going to Metro West.
Right. If there's an emergency or urgent situation, they can go anywhere.
But in terms of the people who are part of your network, of those hospitals, Marlborough, UMass Medical, and St. Vincent, so those folks part of your network?
All part of our network.
All.
Yep, all
Okay.
part of our network. So
Okay.
that's,
And then a lot of the docs are in this area are connected with one of those 2 larger
correct.
systems.
That's right. So this is a good sweet spot for us for our senior plan, for our
Yeah.
Medicare Advantage plan. So to go a little further with the Medicare Advantage plan, so we have 6 different types of plans people can join here in Worcester County. One plan is $0 premium. It goes all the way up to $275 a month for a premium. That's the most expensive plan we offer. As you go up in monthly premium, your copays are less money.
And if I'm doing one of these Medicare Advantage plans, to be clear, as a result of that, am I eliminating my Medicare Part B monthly payment?
No, you still have to pay that.
I still have to pay that.
Right.
But in terms of the deductibles that you were just talking about, or the co-pays, right, which otherwise you were getting taken care of maybe by a Medigap plan, it's in lieu of all of those payments.
Correct. So Medicare Advantage is set up a little bit differently, where you pay the monthly premium and you have copay responsibilities under each plan. So the copay, one plan might have a $25 copay for a physician visit, for a PCP visit. Plan you pay a little bit more for, that copay might be $10 or $15.
So going back to the point that Bill had made, it's a matter of it's October. And I'm saying, how am I feeling? Right? And I'm just taking a guess, and knowing that if I guessed wrong, at the worst, I guessed wrong for 1 year. Right? And then I can restart this clock at the beginning of the.
Some people have good years, some people have not so good years.
And speaking of good years and bad years, one feature of the Medicare Advantage plan is that each plan has its own annual maximum out-of-pocket expense. So they range from a low of $3,400 on our more expensive plan, all the way up to $6,700. And if you should hit that in medical expenses, you pay nothing for the remainder of the year.
So for your least expensive Medicare Advantage plan,
Right, our zero-cost plan.
the maximum amount out of pocket that you could pay. I'm going to go back to the example that you had both used.
Right.
My $100,000 heart attack. So I had $100,000 in bills, either to the doctor or to the hospital or to whatever. And under traditional Medicare, right, I was going to be paying 20% of that number. plus that small deductible. So around $20,000, right?
Right.
So under your least expensive Medicare Advantage plan, the most I'm paying in that case is $6,000. Am I getting that right?
But you're close. That is the maximum, everything during the whole year. A hospitalization has a maximum of 5 days that you have to pay for, and there's a copayment for each day. So on that zero-cost plan, for example, it's $370 per day. So if you're in for 2 days, it's $740, and if you take that $370 times 5, you're up about almost $1,900. So if you're in for 10 weeks, it's under $1,900, and that amount applies to that $6,700 out-of-pocket maximum for the year.
So while we've just heard a lot of numbers, right? And of course, as I so often tell people when they're doing kind of elder law planning or planning related to mass health or whatever, it's all a matter of the numbers. It's a matter of doing the math. Right. And I know a lot of people are intimidated by that. That's hard, right?
Right.
But these are big numbers. You know, these are potentially, you know, when you're talking healthcare, as I always tell seniors, most of my seniors, you know, if you're on Social Security and a kind of a medium-sized pension, you can typically be okay until you die, except for the medical bills. It's the medical bills that can kill you.
Right.
You know, so if you get this right, and somebody else was doing a presentation once, they said, you know, that for many seniors, the difference between a great life and a mediocre life in terms of money is not a matter of $1,000 a month. It's a matter of a couple $100 a month. It isn't a lot of money that really changes your life. So getting this part right is just hugely important.
Right.
So Medicare, so why have I never heard of these, right? Once again, we were talking earlier and you had said that, and I remember reading a story in the paper, which was one of the things that got me interested in this, about the percentage of seniors who are now on a Medicare Advantage plan versus Medicare A and B plus or not plus a Medigap plan. Can you talk about what those statistics are?
Sure. Nationally, there's only about a third of the people are actually involved nationally in the plan. It's been growing some.
In Medicare Advantage.
In Medicare
when you say
Advantage
only,
plans.
that's a gigantic percentage to me. Because I thought it may be like 5%, 10%. A third are already on, right? Nationally.
Yeah, and here in Massachusetts, only 24% out of the 1.4 million people enrolled in the Medicare program are actually in an Advantage plan.
But out of 1.4 million,
the number for Worcester County is a
that's
third.
A quarter of a million people.
They're up there pretty good. It's the highest county in terms of penetration.
I bet among other things because of Fallon, because of the tradition of Fallon of like really trying to do this kind of comprehensive care, right? So it's a big percentage. It's an increasing percentage. Now I just want you to mention one other thing. So in addition to doing all of those things, are there any services that, if I'm in an Advantage plan, that are kind of extras that I wouldn't have gotten if I were on Medicare, on traditional Medicare?
Yeah.
Yes, so Medicare Advantage plans offer a lot of additional benefits. There might be dental benefits, there might be vision benefits, Weight Watchers. We have a 13-week Weight Watcher program that's free for our members that join. There may be a gym membership reimbursement.
You'd mentioned the gym.
Yeah, gym membership reimbursement. We have the Silver Sneakers as part of some of our Medicare Advantage plans where somebody could join that gym. For example, the Burroughs in Westboro.
Yeah.
Expensive for me to join, free for our senior plan members to join, which is really great. Weight Watchers, like I said, anything else. We have vision, dental.
Right. Now, all of our plans, with the exception of the one, have prescription drug coverage. So the Part D is incorporated into our plans.
And that's another piece. Right. That's another. So that is replacing what you were paying for your Medicare Part D. Right.
Someone would only need to buy
as well as replacing what your Medigap would have been on the Medicare A and B.
Right. Sorry. Someone would only really need to pay a separate Part D for a separate Part D plan if they had a Medigap plan, because the Medigap plans don't come with drug coverage.
Right.
And
so
Medicare won't allow you to have a Part D and an Advantage plan.
Right. So if we're thinking about apples versus apples, and once again people are doing the numbers, they really have to say to themselves, if I'm on traditional Medicare and I've got a Medigap plan, which I probably have, and then I've got a Medicare D plan to take care of my drugs, apples to apples, I got to add up what am I paying annually for those two put together, for the Medigap plus the Medicare D, and then look at that compared to a Medicare Advantage plan, right?
And then people have to factor in the fact that they're paying for Part B. $135.50.
Right.
So, a lot of times when Bill and I are doing our presentations,
Except that that's always the case, right?
always the case. You
Always
always
the case.
have to
Yeah,
pay for
yeah,
Part B. So a lot of times when Bill and I do our presentations, we'll stay afterwards, and a lot of these people will come to us. Some people get it right away.
Yeah.
Other people might say, "Geez, this is really confusing. How do I figure out this and this and this?" And while we can't recommend a plan or tell people what plan they need to go on, I like to tell people about the plans and say, "Here are our 6 plans. Here's what we offer. If Medicare Advantage is for you, you know how much you can afford. We'll check to make sure your doctors and your drugs are on the plan, and let them decide
And let
on
them
their own."
decide.
I think it's also important that the prescription drug coverage on the Advantage plans,
Yeah.
the drugs are not included in that annual out-of-pocket maximum.
Correct.
That's a separate, because as we know, some people might have that maximum drug amount, a cost just
Right.
in a given month.
Right.
And that's
Right.
where the programs come into effect, like you have extra help from Medicare, and here in Massachusetts, you got Prescription Advantage. So, the Shine Councils are very helpful in being able
The
to help
Shine
with that.
Councils are important, and I know that one of the things that we had, and that, by the way, that's crucial. And I know that we've had folks from the senior center here talk. We've had the person who's talking, doing the Shine, one of the Shine advisors, right?
Mm-hmm.
And they play a crucial role. The other piece is, I think, as we've talked briefly, is one of the things that we're thinking of doing, right? Is actually when the next enrollment period comes this fall, maybe even trying to set up something where we can have the major plans talk briefly about kind of what's going on, right? In a forum where a lot of people can see it, because I think this is big money. I mean, this is, when I say it's big money, for a person on a fixed income, right? This is big money, right? And to know that every year you have this opportunity to kind of think about, talk to your doctor, figure out what you might need, and then really shop for this kind of item is really crucial.
It's really one of the bigger decisions and that somebody can make in a year, who a senior can make during the year, and it typically is one of the biggest decisions they make as far as either a financial standpoint or, as you say, what their needs are.
And what their needs are.
Right.
So, gentlemen, thank you so much.
You're welcome.
I know,
Thank you.
And I know that we covered just a tremendous amount of material. I bet you've just heard a ton of stuff, some of which you knew, but some of which you didn't, right? So, the moral of the story is, when you're before the end of the fall this year, you want to at least put this on your radar screen. Maybe do a little research now, before the rush comes in the fall, so you can understand this as an alternative. And don't feel like you're going to be like this great pioneer by joining a Medicare Advantage plan, because a third of the people in Massachusetts are already on them, or not a third of but a third of the folks right around here are already on them, right? And there are some really good ones. This is one of them. Thank you so much, gentlemen, for both of you.
Appreciate
and we'll see you again real soon, and we'll see you at the seminar at the Northborough Library, right?
Awesome.
Thank you, and
Thank
we'll
you.
see you on the next installment of Frank and Mary here in Northborough.